start cussing me out and calling me out of my name, I will not see that patient. The light is leaving me fast. Kind of a dark day. What is up, guys? Welcome back to my channel. My name is Lori. If you are new here, I am a family nurse practitioner, and today we are going to do my 6-month update on working in the urgent care space. If you are not familiar with my channel or my growth as a nurse practitioner, I graduated from NP school in 2017. I passed the boards in 2018. I started working my first nurse practitioner job with a physician. I used to work in the nursing home setting, did wound care, and I also rounded in the hospital. I also was working in that doctor's office at a point in time. So I got a lot of experience in all those areas. I did it for 3 years, then I quit and I started working in the urgent care space. It's been 6 months, y'all, since I started the urgent care, and I hate it here. I might cut that out, I might not. You guys, I do not mince my words. You already know that if you watch my channel. Hate is a strong word. I dislike it here. Ooh, you hear that thunder roll? But anyways, I had to jot down a few notes. If you guys are trying to decide between primary care versus urgent care, I also have a video that I did talking about my experiences working in primary care setting, nursing home setting versus the urgent care space. So I'll link that video here. Check it out. I'll also link it down below. 6 months in, and one of the things that I truly dislike, and I've said this multiple times on my platform, and it is antibiotic obsession. I've said this a lot of times in my videos that patients truly are just obsessed with antibiotics, and if they come to the urgent care and they're not given antibiotics, they feel like they were not treated properly. It's just always antibiotics for them, and it is getting to the point now where you almost feel like you're bullied to give antibiotics to patients, because if I don't give them the antibiotics, then, which is my next point, they go and they give you this nasty Google review. One of the girls that I work with showed me this Google review that a lady left on me, and when I tell you, I was heated because it was all lies, and it's because she didn't get what she wanted. And I remember when I did my 60-day review with the supervising person that interviewed me and hired me, and I talked to him about this, and one of the things that, you know, he was saying was just that just tell them that this is why you're not prescribing that, and that's it. Especially when it comes on to strep throat, parents always think that their kids have strep throat, right? And when you do the rapid strep in your office and it's negative, because as soon as you have a sore throat, it has to be an infection, right? People, it's just an infection. It's strep throat. They need antibiotics. They need something. No fever, no nothing. Just a regular old sore throat. I had a parent one time that was just so adamant that yes, they have it. And then, you know, I just said, well, I will send a throat culture, and if the throat culture comes back and it's indeed strep throat, then we'll sign, you know, do the proper treatment, which is the antibiotic. And then she was just not satisfied with that. So it's almost like I'm going to prescribe you antibiotics, but there's no true reason to give you antibiotics, and I'm just not going to do that. And you are not going to bully me and strong arm me into doing this when it makes no sense to do it. The next thing is that they come in and they already know what their diagnosis is, because Google and WebMD already told them that that's what they have. And because Google and WebMD already told them that's what they have, when they come and you're going over their symptoms, some of them get so annoyed because you're asking them their symptoms. Basically, you're just like, I'm here because of so and so. I had a patient the other day that was just like, she can just go ahead and give me a Z-Pack and send me on my way. Well, that's not how it works, because I have to assess you. I have to ask you these questions. First thing out of their mouth is, well, my PCP always give me. Well, go to your PCP. Call your PCP and let them send the medication in. Another thing that just gets under my skin is just the blatant disrespect. You know, they come in and they will argue with the front staff about the policy that this corporation has put in place to sign them in. The staff has nothing to do with the corporation and how they run their business and how they want you to sign people in. I'm to the point now where I say to the staff, if they start cussing me out and calling me out of my name, I will not see that patient. I had an incident the other day where a patient was calling me a bitch, a ghetto bitch, because she came in there because of tooth issues. And I simply asked this lady, do you have a dentist? She got so pissed off. That is a legitimate question, because you need a dentist for this that is going on. And that's one of the things that people come to the urgent care for all the time. Tooth that is broken, tooth that is totally rotted to the root, abscess in their mouth. I get it. You definitely need to be starting an antibiotic, but you definitely need to go see your dentist ASAP, because the urgent care is not going to pull your tooth. We're not going to do any tooth extraction. We're not going to do anything. We're not going to do no maxillofacial x-ray to see what's really going on. You know, it's almost reminding me of the flight attendants who have to deal with these crazy people on the airlines, and you should not go to your job and feel unsafe. And at this point, when I tell you, some of these patients make me very unsafe. And I was saying this to my husband the other day, because I said to him, people are so crazy nowadays. When they start doing this, I put myself at the door and I just say, okay, like I walked out on a patient the other day because of how he was talking to me. And I said, you know what? Okay. And I walked out. I walked out the room, because I'm not going to go back and forth with you. And I don't know how mad you is in your head. And if you're going to knock me down, because what? No, I mean, why you knock me out and kill me in here? My next... I feel like this is such a bad video. I'm sorry. The next problem I have is the urgent care motto is you see every single person that steps foot in the door, even when you know you cannot do nothing for them. For me, you know, to wrap my mind around this, because a lot of times patients come into the urgent care and you know for a fact that you cannot do anything for them. I had a patient one time and the patient was being checked in, and I'm hearing the patient being checked in, and I just poke my head out there and I look. I can look at the lady's leg and I'm like, it sounds like she has a blood clot in her leg. Now, I can't diagnose a blood clot in the urgent care. I don't have a Doppler. I can't do that. So for me, for her to come in, sit, check in, wait 2 hours, and then come back there, and then I tell her, ma'am, you have to go to the hospital because I think you might have a blood clot and you need to go do a Doppler. That just don't sit well with me, when I could just say, you have to go to the hospital because X, Y, and Z, right? I know it's about money, but it just don't sit well with me. And then patients also get upset sometimes and say, well, why didn't they tell me that before I sat here all this time and then I come back here? And this has happened to me multiple times. I'm pretty sure that you guys get the point. And I get a lot of questions a lot of times from some of you guys who say, I'm new and I'm gonna start in the urgent care space. What are your thoughts on this? Personally, I would never start in the urgent care space as a new. I would not do it. But that's just me, and I know my limits, and everybody else is different. I mean, know some people overconfident and some people think say them just got it like that. I would never do it. Especially for NPs. Let's be honest. These FNP programs, they're not doing the best due diligence when it comes on to certain things. And when you go in the urgent care space, you need to know how to do IND, incision and drainage. You need to know how to suture, because these are the things that comes into the urgent care, and these are the things that you're going to have to perform, these minor procedures. Get some practice in that, or do some kind of course in that after you graduate if you know that you want to go into the urgent care space, because you need to know how to do that, and you need to know how to service these patients in the best way possible. So I honestly would have never entered the urgent care space as a brand new NP. I was not prepared for all of what is going to throw at me. Especially a lot of times in this urgent care space, you're the only provider in that space and you're new, you don't have a lot of people to bounce things off of. It's just a lot. It's a lot of eye injury. People walk in urgent care for everything. It could be the minor things to astronomically full-blown probably having a heart attack, and they walk in urgent care. So you need to have some kind of background knowledge or something, you know what I mean? So I mean, I don't recommend it, but everybody is different. That's it. It's safe to say for my 6-month update, I'm gonna be 100% honest, and I said I was gonna give this a try, and I definitely know that the urgent care space is not for me. and I am looking to move on to something else. You came, you saw, this is not for you, and you need to move on. Anyways, guys, that is it. That's my 6-month update of the urgent care space. I don't think I had anything positive to say. Oh my god. But that is the end of the video, guys. Don't forget to like, comment, and subscribe to the channel. Let me know what your thoughts are if you've ever worked in the urgent care space. See you in the next video.